we go. All right. So let me get to the beginning. So in case you don't know much about 1016, just a quick little overdrive. We were started by 9 local churches over 40 years ago, 40 years. Last year was our 40-year anniversary. If you're not familiar with where we got our name, because that's often a popular question, it is our street address. But the reason that the board at the time picked it is because the churches had opened up the open door the year before, and 1016 is a police radio code that means that there is an open door at the scene of a disturbance. And they just thought it was too providential that the street address would have that same kind of meaning. And so that's how we became the 1016 home at first, and then evolved in 1016 Recovery Network. In terms of how we've changed over the last 20 years, this is what we used to look like back around when I came to the organization. Here's what we're at now from a regional footprint perspective in terms of the breadth of services and the locations that we're reaching right now. So well beyond Midland County, although Midland is certainly our home base. Just so you understand kind of the needs in the community and maybe how the pandemic affected stuff. The red line, these represent all Midland County residents, not that just came to 1016, but use the public service system for some type of treatment or help. So the red line shows that the primary drug of misuse at the time that people are getting help has been opiates, has been for the last 10 years when you look at both prescription drugs and heroin together. But as you can see, the pandemic led to a pretty significant uptick in alcohol misuse. Probably a lot of that has to do with access to that substance during the shutdown and whatnot, because you can still have alcohol delivered to your house, or you can have shipped to bring it to you, right? But as we also kind of tear apart what is going on with our opiate situation, you can also see kind of the difference when you look at the pattern between heroin and prescription drugs. You know, back here in 2010, 2011, prescription drugs were the primary drug of choice, and there was a lot of emphasis between the Legacy Center, 1016, Mid-Michigan Health, and others to really get that under control. Well, you can kind of see that as people had less and less access to prescription drugs, many of the people who were dependent upon them would then kind of convert over to heroin. And so that's what you see is the decline in heroin in 17, 18, and 19. Why, as prescription drugs went down, then heroin began to go up. Pandemic brought it both down. Again, I think a lot has to do with access. In terms of services, first of all, we as a community are very blessed that we really do have a full continuum of services that are available to us in town. The Legacy Center does a tremendous job as a partner in the prevention and education space, and I won't steal any of Catherine's work there. But we do a variety of different things. We have outreach in the emergency department at Mid-Michigan Health, where we have an embedded recovery coach talking to patients right there about how they might want to get engaged in services. We have our Center for Recovery and Wellness, which does outpatient peer support and walk-in services. All of those are supported with United Way dollars, where people can come in and really have a wraparound approach, because they get to work with a person with lived experience who is in recovery themselves, as well as working hand in hand with a team of therapists to kind of wrap around them. We also have medication-assisted treatment provided on site through the Great Lakes Bay Health Center. They have a traveling bus that's here every other week. So a person, if they need medication-assisted therapy, as well as psychotropics or primary care, they can get all of that. They were just here yesterday, and we regularly have people hopping in and out of the bus to get the additional support that they need. Residential is out on M20, where people will come to stay with us for about 28 days. Their addiction has gotten so unmanageable at that point in time that they really need that kind of structured, accountable environment for an extended period of time. Recovery housing is also available in Midland County. We have a 14-bed men's house, which is the 1016 home, kind of returning to its roots. And then we also have a 7-bed women's facility over on Haley Street, which is a perfect location because it's in walking distance to the community center, to a lot of shopping as far as Kroger's, and they can walk right down to our facility for their counseling. Detox, we used to provide, we had to close that last year. because of economic concerns when the pandemic kind of came along. So folks can still get that. There are a couple of providers over in Saginaw that is local that we cooperate with, but that is kind of a regional service anyways. Used to be over in Mount Pleasant when we offered it. So all in all, it's all right here. So if you have any individual that you're working with that struggles with any kind of substance use disorder, then their 1016 or other community partners, and certainly the Legacy Center on the prevention, early intervention side is there to help kind of respond. Family and Children also is another great partner in that space on the outpatient side. And then lastly, just want to promote, here's why we do what we do, because when you get people to be able to achieve long-term recovery, what they be able to bring to our community is incredible. The most thing I always like to, they pay their bills way more than you or I do, which is kind of interesting. But most importantly, from a United Way perspective, look at the volunteerism. They actually give back to our community way better than a lot of folks. So that's another wonderful thing in terms of the more that we can help people achieve that, so much the better. So that is our quick flyover, and thank you for your time.
Thanks so much, Sam. Any questions for Sam? Great overview, much appreciated.
Thank you for having me.
Any volunteers to go next?
I feel like I should go next since Sam did a nice little shout out to me. Thanks for that, Sam. So at the Legacy Center, we believe that everybody can thrive if they have the right tools. And so we strengthen families, enhance well-being, and provide them with tools for success through literacy, substance use prevention, and youth development. And to give a little historical perspective on our three areas, we are a conglomerate of 3 agencies that joined together, 10 years ago almost. So the Legacy Center for Student Success was founded by Dr. Dick Dolinsky and focused on looking at what made kids successful and what barriers got in the way. And he introduced the 40 developmental asset framework to Midland community. And then in 2011, we merged with the Literacy Council of Midland County. And in 2012, we merged with the Midland Area Partnership for Drug-Free Youth. And those both brought those real life applications to the 40 developmental assets. And all 3 agencies were working towards bettering outcomes that, in the end, benefit youth. And so it was a pretty natural fit. So I want to start with our literacy programs, because one of our literacy programs is how we receive United Way funding. We have 2 and almost a third. We're working on our third portion of the literacy expansion, I guess you'd say. We have the Barton Reading and Spelling Program, which, I'll get into details in a minute. So Barton Reading and Spelling, we have adult basic education and English as a second language, and we are working on launching a new math tutoring program. It seems to be the biggest gap that's not being filled elsewhere in the community, and so we're soft piloting right now. The Barton Reading and Spelling Program is our United Way funded program, and it serves primarily youth, but any individual who has a specific learning disability in reading or dyslexia. Our program is a structured, explicit, multisensory curriculum that's done in a one-on-one tutoring capacity. We pair 1 volunteer tutor with 1 learner, and they work together for a minimum of a year. Most of our students will graduate from the program in about 2 years when they've reached grade level. Our adult basic education and English as a second language programs work with adults whose skill levels are below 9th grade. And typically we're working with individuals who struggle with reading or math skills, and then English language learners who have very low levels of English. We're part of a pipeline for workforce development in the adult basic education and English as a second language program. So we work with the lowest level adult learners. When they complete our services, we connect them up with employment employment services at Michigan Works because we have a location there at Michigan Works. And so we can provide that warm handoff. We're familiar with their services. And we also work with the Education Training Connection facility out on M20. And that's where an individual who wants to get their GED would go after they finish working with us. Our substance use prevention programming, through that we do community and classroom-based education in order to reduce youth substance use, but also to reduce the negative impacts of substance use disorder among adults in our community. So we lead our local community coalitions to coordinate local projects like Narcan training and Narcan distribution, community education campaigns around cannabis use, like our Good to Know campaign, or also the Chances Are campaign, which is about reducing stigma for individuals with substance use disorder and really treating it as a disorder so that people can feel more comfortable getting the help that they need. So we work with the coalitions to identify needs and gaps and then pull together partners to address those gaps. We also in the classrooms do a lot of classroom-based education. We help high school students put together campaigns. We do substance-specific education. We do social and emotional learning because those are often the root causes of when kids start experimenting with substances. So that's the earliest level of prevention is to get kids strong in those areas. And then new this year is our in-depth program, which is an early intervention program for students who are vaping. So that's been an interesting program and we've served a lot of kids through that this year. It's been great. And lastly, I want to talk about our youth development programs. And for a youth development standpoint, we take a broad community approach. We're looking at how do we empower our community partners and parents and community members to strengthen kids and build their 40 developmental assets, which is a framework of 40 things that kids need to be successful. The more of them that they have, the less likely they are to engage in risk-taking behaviors. And just by helping our community understand that framework, we're able to impact youth in many ways. So here in-house, we have a magazine that goes to the homes of all 6th through 12th grade students in Midland County that goes to the parents and educates parents on what their kids are struggling with and how to build up their kids. We like to highlight lots of our nonprofit partners and all of their activities as well in that magazine. It's a great resource. We also have a new podcast that we launched this year for family and community members. And then the Midland County Youth Study is, at this point, it's kind of a longitudinal study that has shown our community the growth in developmental assets and risk-taking behaviors among our kids since 2006. The next study will be launched in fall of 2021. And we share that data with schools and other nonprofits to help. It's kind of a needs assessment. It provides them with the tools or the information that they need to build stronger programs to build up youth, and elevates the conversation about what our kids are struggling with and how we can be most influential in their lives. So we're anxious to get that data this upcoming year so we can find out how the pandemic really affected kids. But that's our quick overview.
Fantastic, Catherine. Thanks so much. Any questions?
What's the name of the podcast?
Directions not included.
Awesome. Okay. We have a volunteer to go next.
I can go next.
Thanks, Kelly.
Yep. So I'm Kelly Poulon, Executive Director of Disability Network Mid-Michigan. I've been with the organization for a little over 26 years. Disability Network is an organization that began in the late 80s as a program called the Independent Living Program under the ARC of Midland. And in 1990, we established ourselves as a standalone agency, and we were called Midland Center for Independent Living at the time. And Centers for Independent Living are grassroots advocacy organizations that are located in every state across the country. And we are unique from other disability organizations in that we can serve anyone of any age with any type of disability without any restrictions. We're also unique in that one of our requirements of being a federally funded Center for Independent Living is that 51% of our employees and board members must be people with disabilities, so that we're coming from the same or similar perspective of those we serve. And so proudly, our agency is well above the 51%, with 85% of our employees being people with disabilities. Our agency serves 12 counties in the mid-Michigan area, with Midland being one of them. And we're part of a greater network of 15 centers for independent living in the state of Michigan. And there are over 300 CILs across the country. And in 2007, in conjunction with the other centers for independent living in the state, we embarked on a rebranding of ourselves to Disability Network and identifying the part of the state that we represent. So that's how we became Disability Network Mid-Michigan. We're still considered a Center for Independent Living, but now our name essentially better portrays the fact that our geographic reach is beyond Midland County. It makes us more searchable on the internet because we have the word disability in our name. And then the name change also helped us dispel the myth that we were a facility or a center where people could place their loved ones, because we were constantly getting calls asking if someone could bring a family member to live at our organization. And that's pretty counterintuitive to our desire for people with disabilities to live independently in the community with the supports that they need. The mission of Disability Network Mid-Michigan is to promote and encourage independence for all people with disabilities. And our vision is creating accessible and inclusive communities. And as a federally funded Center for Independent Living, we're required to provide 5 core services. And then we can also provide other services to meet the needs of our community as we see fit. And so our 5 core services are information and referral, which is essentially the front door or the starting point in our agency, where we can assist people with disability resources and information to help them increase or maintain their independence. Community transition services is where we can assist people to transition from a nursing facility back to living in the community with the supports that they need to maintain their independence. We provide individual and systems advocacy, where we can assist people to advocate for themselves regarding their disability and their rights. And then we also serve as a voice at the table when local, state, and federal policies are being developed that impact people with disabilities, so that we can create systems change for people with disabilities. We have a peer support and mentoring program where we serve as allies for other people with disabilities, learning to navigate the world either with a newly acquired disability or changes to an existing disability. And then skills development is a program where we help people with disabilities learn the important skills they need to either increase or maintain their independence. And because we serve 12 counties, diversity in funding is critical. So United Way funding offers assistance for us to run our youth transition program, which is called Stages, and that falls under our skills development core service. And the Stages programs, Stages stands for Students in Transition, Achieving Their Goals, Empowered and Self-Confident. And this program typically impacts about 190 students a year, and our United Way funding helps us impact about 18 to 20% of those individuals. We know that youth with disabilities have a higher incidence of becoming high school dropouts, which then can lead to higher rates of unemployment, can lead to poverty and lower contribution to their communities. But on the other hand, we also know that early intervention, community-based supports, and mentoring can increase the chances of youth with disabilities to successfully transition into adulthood, be prepared for employment, college training, and just independent living in general. So we start in the early years of high school because we know that early intervention gives youth more time to practice skills in a safe environment over the course of several years to increase their success. We use community-based supports and instruction so that students have opportunities to practice skills in real life situations. We use mentoring as a way to offer continued support along the way, as well as modeling. We rent a barrier-free apartment here in Midland where students can learn and practice skills in a real life setting. And then we partner with the schools and local businesses to offer one-on-one and small group community-based instruction. And some of the skills that we help students develop are things like citizenship, personal and relationship skills, health and safety, assistive technology, money management, home living skills, awareness of their community and how to be safe, transportation options, goal setting. We work on some leadership skills, employment and work readiness skills, and then college or vocational training and prep as well. And then we have a summer program where we help the students to develop social skills by participating in recreation and team building activities. And we schedule tours of businesses so that students can see firsthand what it might be like to do a particular job. As I mentioned, we partner with schools and businesses in the community, but we also partner with Michigan Rehabilitation Services as students transition to actually looking for a job when they're ready for that step. And then some of the struggles that we've really faced during the pandemic really were continued access to the students through the schools, obviously dealing with remote learning fatigue. We developed a lot of great virtual opportunities to help students engage. And so we're still hoping that some of that will carry us through the next few waves of the pandemic. And then we're kind of hoping that as vaccines wrap up, we're going to have the opportunity to potentially do some limited one-on-one in-person activities with the students outdoors, hopefully this summer. So that's kind of us in a nutshell. Thank you.
Thank you, Kelly. Any questions? It's been great to see the love in the chat too. So I'm sure everybody appreciates some positive accolades for all the hard work that you do. Thanks a bunch, Kelly. All right. So Drew, I can only see a few people at a time, but
Yes, I'm here.
there you are. Great. Thank you.
Good morning, everybody. Sometimes people call us Midland Camping Council because that is our official name for a 501c3, but Camp Neyati is how everyone relates to us. We're a 187-acre summer camp that started 83 years ago. In 1938, Midland Welfare Association, which is now called United Way, the Boy Scouts, and Midland Kiwanis Club bought the camp from Jackson YMCA, and they really bought it for organizations here in Midland to start using the camp. So like the community center was one of the first ones to start using it. We were located an hour away in Clare County in the town of Lake, and we're on Crooked Lake. We have different groups, like I said, the community center, West Midland Family, 4-H. We have Royal Kids Family Camp held there, Midland High School, plus several churches that come to camp regularly. When I mean regularly, I've been here 5 years, and a lot of these groups have been coming for decades. The same groups have been renting us year after year, and it's just become a regular staple for their programs. We don't do any programming at camp, so when we're so different than other camps that you might be aware of. Almost every other camp in the state, they do their own programming. They have their own cooks, they have their own counselors. So you register your child there, bring them there, and they take care of everything. We rent our whole entire camp to these different nonprofits, and they come and they bring everything. They bring their cooks, they bring their programming, and make camp what's best for their organization. We supply different things with camp, like our waterfront. We have a wonderful waterfront. We have stand-up boards, we have kayaks, canoes, people can fish there. We have archery range, we have hiking and biking. We have a bouldering wall. We have 9 square in the air, gaga ball. And we just finished disc golf last year, but we didn't have camp, so no one's tried it yet. So we have 9 holes of disc golf. And then this year we're going to try pickleball. So we have a couple, we have a tennis court that hasn't been used in a long time. And so we're going to turn that into a couple pickleball courts. So I've been working on funding for that. We charge groups depending on how long they're going to be there. Occasionally, like the community center will come up just for a few hours for a day trip. So it's for some of their day camps, but most groups come for a weekend or for a whole week. It depends what's best for that group. In the future, we'd love to have groups maybe want to just come up and bring their board just to kind of get away and have board retreats or something like that. We have 2 part-time year-round employees in our organization, myself and George, our caretaker, who's been there about 25 years. So not a big staff. We do hire a couple of seasonal workers to help get camp ready. And we have a waterfront director when camp's going on. Last year, we didn't have any seasonal workers since we didn't have camp. Our budget is around $150,000 for a whole year. $150,000 for a whole year to run our camp. Yes, you heard me right. So we really depend on volunteers. We will have over 200 volunteers most year. Last year, we didn't have quite that. Since camp, we didn't have camp. We didn't have any volunteers until probably the end of July. And that was all outdoor volunteers doing social distancing and doing things that we could do outside easily, you know, like painting or raking leaves or that kind of stuff. We have companies that come up, volunteer. We have schools, individuals that come up. We also have user groups that'll come up and help get camp ready before they turn around and come up to rent camp. So just depends on whoever I can get up. Always looking for more volunteers. So if you're interested, let me know. Our dining hall is a dome dining hall. If you've ever been up to camp, it's 65 years old and it is out of date. It is time for a new one. We can't make a dome any bigger. And we literally have kids eating outside every meal because all of our groups are bigger than 143, which is what it was built for. Also, most of our groups would like to have more cabins. Right now we have 22, but you can't build more cabins unless you have enough bathroom space, and you got to have enough seating space. So it's kind of like a catch-22. So that's our plans in the near future, is to get a new building and get some more cabins and then become a year-round camp. So we can offer groups into the fall, even some winter camps or early spring. Right now we shut camp down totally, just like people do when they have cabins up north, where you have to turn off the water and blow out the lines and that kind of stuff. We have to do that with camp every year. So appreciate your time and support that everyone gives us. And if you're interested and would like to volunteer or like to have your group come up, feel free to contact me.